A social welfare network initiative basically is a nutrition-centered organization. Prior to 2015, and of course the focus on the IDPs. Basically, we've been 100% involved in maternal newborn child health activities in the FCT and 12 other states, supporting a lot of the state primary health care development agencies with implementation of vitamin A supplementation and deworming treatment for under 5 children, which is more on the nutrition-related activities for under 5, the preventive aspect. Our food security activities is actually nutrition-centered. Ours is basically to ensure that every household, individuals in a particular targeted household, gets their basic 100 kilocalories per day, which is what every person needs to maintain a nutritional balance. In critical moments, like in the lean seasons, we focus more, our attention is focused, at the under 2s. Okay, so we provide the ready-to-use therapeutic soaps for kids. Then also a lot of emphasis is also laid to pregnant and lactating women. So it's basically an integrated approach. Make sure that they get the Super Cereal Plus, and of course the Super Cereal Plus Plus for the kids. Then of course the basic amount of vegetable oil to ensure that nutritional balance is maintained, and by extension prevent malnutrition. We observe all the protocols as much as possible. What happens is that the military provides buffer. You have what you call the outer perimeter, while within the perimeter you have the victims who turn beneficiaries of our intervention, and of course 47 other UN agencies and international NGOs plus the national NGOs working within several clusters or sectors, in that area. You can't run away from the fact that agric is the only way out. I know that there is a new innovation, which the irrigation farming is something you can do, but of course you need land to do that. So you can, what we've agreed, what we've seen, and what we've practiced, that we've seen it worked within the IDP camps where there is no land, is what we call the backyard garden or the micro garden. Okay, the micro garden does not need any land space. One, micro garden is able to produce enough food for the family and to spare. So we've practiced it clearly using a sample size of about 5,000 IDPs, and they were able to produce tons of food for the family. So the focus was on basic vegetable staple. So you're talking about amaranthus, talking about okra, talking about cabbage, carrots, lettuce, roselle, and the rest of them. So for a longer term approach, I believe strongly, given the security issues, micro garden is the way to go. You don't need big land. You can do micro garden in this house. If you have a house where you have just 2 by 2, you can do a backyard garden. So it's that excellent. It's like planting flower. So it's excellent, it's lovely. You can plant your pepper there, you can plant your tomatoes, so you just have enough to make your stew, your vegetable. So in the morning you can do your fresh things, and for those of you who like to eat all those, what do you call them now? The noodles. So you can mix all of those stuff and eat healthy. So for us, that worked, and we believe strongly that if that is adopted, strengthened and scaled up properly, it will help a great deal in sustaining the people, first on the early recovery part, and of course improving the nutritional status of most of these people, most of the IDPs.